Is it recording? Yeah, it is.
Okay, ready? Are you
What are you
ready?
gonna do?
Go.
Okay. Hi everyone, my name is Kimberly and I'm going to be doing a presentation today on the importance of proper body mechanics. Since our field is going to be in physical therapy assistant, of course you all know we're going to be doing a lot of lifting, carrying, walking, and so that we have a proper idea how to do all that stuff, we can prevent from getting any kind of injuries. Does anybody know what the proper body mechanics is for and what it does?
Help you don't hurt yourself?
Pretty much. Proper body mechanics refers to the way we move during everyday life. It's practicing to correct your posture, to protect your body from any pain or injury, especially your back. So we're going to go over standing, walking, lifting, overhead lifting, carrying objects, lifting a patient, pushing and pulling, sitting and stooping. So the first one we're going to do is how to stand properly. So of course, if we're going to be doing a lot of walking, you want to make sure you have proper tennis shoes on, something that has a firm foundation and keep you from slipping. Because if you're going to be lifting up people and stuff like that, you don't want to slip and fall and hurt somebody and hurt yourself in the process. So when you stand, you want to make sure your feet are about hip width apart, not too far. Make sure your feet are flat and keep your back straight. Avoid bending. Avoid locking your knees. It stops the blood flow and you can tip over things, stuff like that kind of thing. When walking, you want to make sure you are standing up straight. Keep your abdomen tight. I know it's kind of hard to do because you forget, you get in a rush and do stuff. But as much as you can, make sure you keep your tight. And if you're going to be helping somebody, so of course we're going to be in the PTA, so we're going to be helping people walk and stuff like that. You want to make sure that you have a hand behind their back and your other hand is at your side ready to help if needed. So the person is going to, you don't want to have your hand over here and looking and we're doing something else and the patient's not being supervised, something could happen. So you just want to make sure you have those good stance, keeping everything tight. So the next one I want to go over is overhead lifting. So overhead lifting is usually something that's high above you that you can't reach. So whenever you're going to do overhead lifting, you want to make sure you have something sturdy to stand on, a step stool, a ladder. When you step on there, you want to get as close to the object as possible. You want to grasp the object with both of your hands and bring it down towards your chest. When you bring it down towards your chest, make sure you have a firm grip on it and slowly step down from the step stool. When you turn, make sure you turn your whole body. Do not turn at the waist. That causes back problems. You can hurt yourself. And then you go about your day. Just make sure you can keep it a firm grip on it. The next one is lifting an object. So I'm going to show you how to lift an object. If I can have a volunteer, please. So we're going to use this backpack here. We're going to pretend it's kind of heavy. Not too heavy. We're going to pretend. Okay, so what we're going to do is you're going to make sure your feet are in the standing position. Do you remember what the standing position was? It was standing flat. And we're going to make sure we're facing the object. So you're going to lower your body to get close to the object, and you're going to bend your knees. Do not bend at the waist. And keep your back straight. So you're going to come here. Yep. You're going to keep your body, then you want to get really close to the object. So you're going to get close to the object, keep your back straight, tighten your tummy abs. You're going to bend at your knees. You're going to come here, make sure you keep your tummy tight, and you're going to grab the object. You're going to grab both hands, and you're going to lift up. And then when you turn, you're going to make sure you turn your whole body. So when you turn, you're going to do a pivot step. So you're going to hold this, do a pivot step, and bring your other foot in front of you, hold it there, and then you continue walking. Now when you put something down, you're going to turn again, but make sure you turn your whole body, so a pivot step. And then you're going to bend your knees again. Keeping your abdomen tight, you're going to bend your knees and set the object down. Keeping your back straight and come back up. And that's how you lift an object properly.
Good job.
Okay, so the next thing we're going to go over is lifting a patient. So it's kind of the same thing as lifting an object. You make sure you keep your back straight, and this you're going to use your quad muscles. So make sure the patient is really close to you. You're going to engage your abdomen muscles to protect your back. You're going to hold the patient while keeping your knees bent and use your leg muscles to stand and lift the patient at the same time. This is best accomplished if you keep your possible when you come straight up. The closer you are to the patient you are lifting, the easier it will be for you to use your legs and avoid throwing out your back muscles. Use smooth movements, don't use jerky movements. If you use jerky movements, you tend to strain your back. You don't want that to happen. And if the patient is able, let them assist you. If it's too heavy, don't do it on your own. Make sure you go and get help. It doesn't hurt to ask somebody to help you. Make sure you know your limits so that you don't hurt your back. The next one is pushing and pulling. So we're going to have one more volunteer for pushing and pulling. So we're going to use this chair again. So we're going to turn this way. And I'm going to have you stand on this side. So when pushing and pulling, you want to make sure you use your own body weight to push or pull an object. So what we're going to do pushing first. You're going to place one foot behind the other. Bend both knees. Keep your back straight. Tighten your abdomen muscles. Shift from back leg to front leg and slowly push with your arms and legs. So you're pushing this way. Okay, so the next one we're going to do is pull. So pulling, you're going to grasp the object, flex your elbows, lean into the object, and shift your weight from front leg to back leg. And pull back. And that's how you pull. Make sure, if it's something that's too heavy, you always get someone to help you. Don't ever do this on your own. The next one we're going to do is stooping. So stooping is kind of like a squat. So you're going to stand, and I'll do this one. You're going to stand with your feet about 10 to 12 inches apart, which is your standing position. You're going to lower yourself by flexing your knees. So I'll come this way. You're going to flex your knees. You're going to put more weight on your front foot than your back. Oh, I'm sorry. Sorry guys. You're going to put one foot forward, one foot back when you're stooping. You're going to put more weight on your front leg than on your back, keeping your back straight, and you're going to stoop straight down, making sure all this stays tight. And then when you stand back up, you put all your weight on your back and stand straight up. And that's stooping. The next one we're going to go over is sitting. When you sit at a desk, the proper chair to use is a chair that's hard with a straight back for back support. If you don't have one, another thing you can use is get a towel. You roll that towel up, you put it right on the small of your back, and you have an arch support. Your chair should be high enough that your knees are a little bit higher than your hips, with your feet flat on the floor, and you should always be able to rest your forearms on a desk so that your elbows are flat on the palms. And that's proper body mechanics. Does anybody have any questions?
If you have back pain, what are some of the exercises you can do?
Some exercises you can do when you have back pain. Low back pain are a supine single knee to chest, which is laying on your back, bringing one leg up towards your body. That relieves some of the pain in the back. Pelvic rotation, where you rotate your knees side to side, and a pelvic tilt to help strengthen the abdominal muscles.